Let's talk to Laurence Gerlis now. He's GP at Same Day Doctor and then also an NHS GP with over 30 years' experience about these, extraordinary claims being made in a report from the Royal College of Nursing about really war zone-like conditions in many A&Es. People not only waiting on trolleys for 24 hours, 48 hours plus to be treated, but often patients even dying on trolleys and corridors and no one noticing or having time to deal with it. Let's talk about this. Laurence, I mean, is this what you recognise? Is this your experience?
Yes, and as your caller from Wales said, we do have a winter crisis every year, so why the fuss? I think why the fuss...
Well, no, his point was it's been going on in Wales for a decade and no one cared.
Yeah, it's been much worse this year. We've been a bit unlucky because there is a very bad flu epidemic. We're seeing a huge amount of flu. I can't remember the last time we saw this much flu. We've been distracted by COVID, which we had no flu during the 2-3 winters of COVID. Yeah. And we haven't had a bad flu epidemic for over 10 years, but this is a bad one. And the other thing, the timing is terrible because if we're going to have an epidemic, then over Christmas when people are socializing, going to restaurants, sitting indoors, it's a super spreader situation, and I'm afraid we're reaping the whirlwind of that. So we have been unlucky. I'm not apportioning blame. If you run a service at 90-95% capacity, then clearly when these things happen, you don't have any.
But the rest of Europe doesn't do this. The rest of Europe, and often those countries that don't even spend more as a percentage of GDP on their health services, they run at sort of 80% capacity. So if there's a major accident, if there is a big outburst of flu or any other disease, they've got the capacity built in. A lot more stats that have come out today suggesting that 1 in 7 of all patients sitting in hospital beds right now in England actually don't need to be there. They are physically able to go home. I mean, 1 in 7. That's got up. It was 1 in 8. Now it's 1 in 7. But again, how many times have we been told we've got to deal with social care, otherwise we can't deal with the pressures both going in and leaving our hospitals? And yet, once again, the problem of dealing with social care and funding it nationally and tying it in with the NHS has been kicked into the long grass by a new government, as happens every time from every new government. Remember Boris Johnson? I've got a ready-made plan. Never saw it.
No, you're absolutely right. That's one of many factors, and the fact they kicked that can down the road was a great disappointment. Yeah. Freeing up hospital beds would be important, but that's been, it's there are many factors. I don't like to criticise my fellow GPs, but general practice is in its own silo, and they tend not to deal with seriously ill patients. I've heard GPs say, no, we're not for urgent care. You go to A&E, and A&E has become the dumping ground, I'm afraid.
Neither an accident nor an emergency, something you should have gone to your GP for, And,
I blame us, the public. Many of us misuse or overuse accident and emergency. And more importantly, we voted for this because every time an election comes up, if any party were to say we're going to do a radical reform of the health service, with safety nets for the vulnerable, but there would be something that introduces fee paying to make us like those European countries you refer to, we wouldn't vote for it. So the public, in their own way, have voted for this, and we can't ignore our responsibility. If this is unacceptable to us, we need to do something about it. I've got lots of ideas, but I don't profess to be able to solve this problem. Our population has grown. We've got the elderly.
But again, the people in charge, that world-class civil service we've got, and all those clever ministers and things. Surely, I mean, oh look, we've got a whole load of people, particularly say I always talk about this. My parents' age, you've got the baby boomers. Oh, look, there's a massive, big, huge extra bulge in the population of another people who all in the last few years have got to an age where they're, I'm afraid, getting more ill. I mean, everyone you will see, there's a point where you've got these people who are really, really healthy at 70, doing really well. 75 seems to start going downhill. People need more and more care through their 80s and 90s, and it was totally predictable. It's as predictable as we've got a load of kids being born in 1 year. I wonder if they're going to need schools to go to in 4.5 years' time. It is ridiculous that we don't do any proper planning. We don't think we need to train up a load more doctors. We need to have more hospital beds. There's going to be more pressure on social care. It all happens to us, and it's an absolute surprise. And just as the winter crisis is a surprise every year, even though it comes straight after the autumn crisis, I mean, at the end of the day, it's a complete abject failure of long-term planning and thinking. And I blame both politicians, civil servants, but also, crucially, NHS managers.
Yeah. You know, I agree with everything you say. Look, I think that we need to... The money's in the wrong place. There are 30% more doctors in hospitals than there were 5 years ago.
Are there?
There are plenty of doctors. They're in the wrong place.
But wait a minute. Are they? Is that per full-time doctor, or are they working 3 days a week?
No, that's full-time equivalent. There are 30% more. But they're not the doctors working in accident and emergency. They're being soaked up into all other roles, which are just as important. But we have a silo mentality in the health service. The money's in the wrong silos. We should have an integrated system between general practice and accident and emergency. The separation of general practice and hospitals is one of the causes of this situation, because GPs can, and they're very busy, but they're doing a lot of admin, a lot of chronic disease management. Yeah. They won't see these sick patients. A lot of these people in hospital have been sent there from care homes, or they're elderly people on their own. You know, if you're in a care home and they tell us they're not nursing homes and you get the flu, they'll just call an ambulance and send the person into A&E, and then there'll be a bed blocker. And that's not the way to run a health service. There should be a better community care service that integrates GPs and hospitals, and that would be a start to solving this problem.
I mean, a lot of people who've discussed this before, they talk about, the Cottage Hospital system. Yeah. But again, everyone says it's very complicated. Well, yes, it is, and it's very costly. Yes, it is. But it's not really negotiable. And it seems to be it's only when you get certain stories that hit the front page, certain crises, that people, the politicians, finally sort of wake up and say we have to do something about it. I had quite high hopes for Wes Streeting, and I did think, you know what, if you're going to reform the NHS, it's probably going to be easier coming from a Labour health secretary than it is a Tory health secretary. 24 hours to save the NHS and all that nonsense. But I just don't think we're going to see anything of it, because they're so beholden to the unions. I don't know why the unions are still so wedded to this system. I have a friend who has just got back from a long Christmas, New Year break, who's Romanian, went back to Romania. I said, well, did you have a good holiday? And she said, well, actually, I was in hospital for 2 weeks of it. I got really seriously ill and I was in hospital. I said, well, lucky you being in Romania, because you probably got into hospital quicker, you were treated quicker, and that's probably why you've recovered, so well. I mean, and she laughed and said, yeah, that's probably true. I mean, it is bizarre. I know so many people who now have private healthcare who either would never have thought of spending their money on it, they didn't have the money, that wasn't something they could just easily just get, or they morally thought, I wouldn't do that, that's, I rely on the NHS, who are now just, sod it. I do not believe the NHS is going to be there for me in my or my family's time of need. So people always say they don't want to have a service that's different for the rich, that's different for the poor. We've got that.
We've got that. We've had a two-tier system for a long time. Exactly right. It's managed decline, Julia. We're just managing the decline of the health service. It's not going to change. There isn't the political will. There actually isn't the demand from the public, because... The RCN can produce this report, but if everyone will forget this in 2 months' time.
2 hours' time.
Yeah, exactly.
Well, I mean, again, it's just bizarre, but I don't know anyone who hasn't got a personal experience of not being able to see a GP when they need to, not being able to get into A&E, not being able to get an ambulance. Everyone, I've got a healthy family. Okay, we're sort of, people eat fairly well. No one's sort of, they're not smokers or really obese. We're very, very lucky. We haven't got all these chronic diseases. And I know what. So I've got 4 members of my family who've been failed by the NHS in the last couple of years. So, I can't believe that other families haven't got more. So why isn't there a public demand for change?
Because people in this country, they're absolutely wedded to the idea of not paying for healthcare.
We do pay for it. We pay taxes.
Yeah. There are people that refuse to pay anything extra. I know people, you talk about people take out insurance. I know people who can afford to take out insurance or to see private GPs who just refuse to do it. It's totally against their DNA. As far as they're concerned, NHS healthcare is, in inverted commas, free. Yeah. As you say, it's not free at all. We're paying a lot.
Yeah.
But people...
Keir Starmer's family. He said he proudly tells this story, doesn't he? Yeah. It's fascinating, isn't it? Dr. Laurence Gerlis, so appreciate you joining us, a GP at Same Day Doctor. Thank you for that.